So my first question is, what impact from COVID do you think the community that you serve or you live in will take the longest to recover from?
Let me think. Well, I'm going to name a couple of them, maybe. Yeah. One I think is that because the parents had to keep working, they didn't have. So I work with Latinos who are undocumented, like work two jobs. They didn't have the privilege of staying home, the parents, and the kids did try to continue doing school in the home. The parents didn't have in many cases good connectivity. So education, many kids got so demotivated with education that it's really very hard for the parents even to push them out to go to school. Some kids don't want to go back to school. In middle school, I can say that. So that's a big one. Another is, so we did have a lot of deaths also, and like families that lost their, because they were exposed to COVID, and so we have families that lost their main provider. And that's another. And then the community is amazing because some of the families, like the neighbor decided you can come and live just with us, but then that has created more poverty because even though they are helping each other now, there's like more people living in a house, in a small apartment. I think the other, like, we had in our town, a lot of people moved in, I guess that left Philadelphia, the larger cities, and then the price, that there was a good time to buy houses.
Yeah.
But that pushed out a lot of tenants that were renting there. So it has been impossible for the people that still have their jobs there to find housing in our town.
Which town is that?
Hamilton. Yeah,
That's helpful.
yeah.
So my next question that we ask everybody is, have you been vaccinated?
Yes.
Yeah, you're here, so you have.
Yes.
Yes. So why did you choose to get vaccinated?
I trust the scientists.
That's good. So where do you go for information about COVID and the COVID vaccine? What source do you trust?
Well, one is the CDC, the internet websites. I did follow New Jersey Health Department announcements, and I'm in the health field, so I also get emails. But that I don't think I represent my community. I'm Latina myself, but a lot of my we have a struggle. I lead an organization, a nonprofit. We have about 46 employees, and it has been hard to get our providers to choose to get vaccinated. And it was, well, a lot of disinformation.
So what are some of the main reasons they don't want to?
Well, one thing that I started hearing from some that Catholic, that because the vaccine was being tested on fetuses that had been aborted, and they don't believe in abortion, so they didn't want to participate in that. So like, my goodness, it's like, and so that's one thing that I heard. Yeah, the other reason is what this idea that in our field we work with children with in the spectrum, the autism spectrum, and the vaccinations are one of the causes. So
yes, that's a favorite.
Yeah. Just a lot of misinformation.
You know, the Pope told people to be vaccinated.
Yeah, it's still like people, I don't know.
You know, yeah, I understand. Yeah, I'm Catholic too, so I hear it also. But Um, so what are some of the barriers or challenges to getting the vaccine that you have seen or that you have experienced?
Well, a lot of the people that we work, like I know, like I was contacted by the New Jersey Department of Health with texts and emails like, oh, we have your vaccination ready and go get vaccinated. My insurance company also contacted me. So it was just readily available for me. I could make an appointment. I have in my cell phone, I can make the appointment. I know how to navigate. But for people, no, they didn't, like we work with undocumented, they never got an invitation. Then they didn't know if they are uninsured, they didn't know if they could. Then we started providing information that they could in the clinics somewhere. But then the clinic only provided vaccination within work hours. And then how do they get there if it's only and are they going to take the day off to go? And the employers, of course, the companies will support that. And then there was the other issue of transportation. But we did manage to reduce all barriers. We brought, we partnered with a transportation agency to take them to the clinic. We brought what did you say, like the vans that provided the vaccination. We had to do a lot of education and Facebook Lives to tell people about the vaccination and now try to respond to answer all their questions. So we did see some, I would say maybe 50%.
Okay. So are there any other ideas that you can think of now that might have made it easier earlier on?
To get vaccinated? I think what I think is that people trust relationships. And I think that, so now the medical system is so like mechanic that people tell me, and the doctors change, they don't really have a relationship with nurses or doctors. So they don't trust, they don't believe the doctor, they don't feel like, so I think that's a big problem. And the reason that I think why we were successful is because we have a good relationship with our community. And we say like, I got vaccinated, you can see me here.
Yeah.
And we know each other, we have meals together. So then they trust. I think the relationship matters a lot.
I think so too. I think so too. So what do you think that state or local organizations could do differently that could help build trust in the vaccine and that process?
Build relationships. So we one thing that we did that helped us is that we created this network of connectors, we call them, that people in their neighborhood that are friends already, like kind of the influencers. They were the ones who got it done. I'll drive you, tell me at what time I'll go with you, we will do it together. If something happens to you, you get sick, I'll take care of you, I'll take care of your kids, all of that.
Yeah.
Some of the parents said, like, I know I don't want to get vaccinated because I heard that my friend got very sick. She couldn't even go to work and she didn't have anyone to take care of her kids. I don't want that to happen to me. And so, but if the connector said, don't worry.
Yeah.
If you get sick, I'll be there. I'll take your kids and you'll be fine.
That's so good.
Yeah.
That's really good. So what do you think that our state and local health departments and hospitals could do differently to encourage people to get vaccinated?
Relationships. I think that now we are like investing in training community health workers. That's kind of because the connectors were funded by a grant, but we are looking for how can we get funding for this role that we have been very successful. It's successful because then you don't need to hire an interpreter. The person is already bilingual.
Yeah.
It's a person that is loved and trusted by their neighbors. It gives a job to the community health connector. And then if the doctor only has 5 minutes of the nurse also because they have like, and I understand that need because there's a shortage of clinicians and doctors and nurses. So you cannot expect the doctor needs to see maybe 10 clients. Yeah. But the connector can play that role. That I'm here with you. I'm like listening to you. I understand, and the connector can facilitate the communication. So I think that's why we need to invest in the relationships, because people, I think many people, most people are like sick of loneliness and feeling that like well, maybe I would say I feel that caring about each other has a very healing power. So if I feel you really care about me, for some reason people get better. Like,
Yeah.
just when they feel that somebody cares about them.
Yeah, no, I think, I think you're right. That makes a lot of sense. So have you had the opportunity to talk to a healthcare provider about the vaccine?
Like for them personally?
Yeah, be able to ask questions and stuff?
Not really. I feel like myself frustrated about the fact that I go to see the doctor and the doctor only steps in 5 minutes, talks looks at the computer and like goes on. So I don't really care anymore to try to establish that relationship. Like, so no, it's not the doctor that I talk to.
Okay. Yeah. So my next question is, do you think that all communities across New Jersey have had equal access to the COVID vaccine?
No, it's not. Yeah, I also work with deaf and hard of hearing people.
Okay.
I think they were also ignorant. There were not appropriate communications for them, transportation, supports at the clinic, education. There was nothing.
Yeah, I think.
Not nothing, but not sufficient.
Yeah, especially when we were all masked.
Yeah.
I thought about that often because I mean this is how they hear.
Well, they see some of them, they can read lips, but
yeah, but then we're all
masked. Yeah. And then also rural areas, of course, we have a serious problem with transportation inside Jersey. So many people, they were not. I think more home-based services, more local services.
Yeah.
But the other thing, because so many that I think that was a barrier is that while we were working from our homes, the people that did have to work, they were working more hours than us that were at home, because they had like one person had to now stay at the shop and do more work for everybody else. So that created a limitation for people to have time to take care of the health too. Yeah. So they have this is an opportunity for them. They get to work more and make more money, but then they don't have the time to take care of their health. So true. That's so true. So that's really helpful. And that is the end of the questions I have. Is there anything else that you think is important to share or that you would like to share? So only about vaccination. Whatever. Yeah. Let me think. No, I just hope that I just really what I learned from this experience is that social capital really is a resource that we need to leverage. So we always think only of financial capital. Yes. But we are not really leveraging, and that was what was precious during COVID. The people did come together, but very, I think it's because we go back to prioritizing money. We forgot that there's so much that we were able to create that was because of the relationship. And then so money is not the solution to everything. Yeah. That's what I would like to leverage. That's really important and very helpful. Do you have any questions for me? Yeah, well, you work for this, you work for a separate organization? Yes. Yeah, so me and my colleague over there, brown jacket, we are consultants that are working with the Y on this project. Yeah. It's fun. You get to hear stories. Yes, yeah. No, it's really been a great experience. So yeah, and I think they do a very good job.
you know, it's been very interesting. And I think it's helpful
Yeah.
information.
Right.